The Positive Pause is a motivational-minded podcast covering topics women want to know about as they journey to and through menopause, focusing on subjects that impact women's health and healthy aging, including what it means to age healthfully. The Positive Pause features experts and influencers from a variety of industries and specialties. The information and opinions expressed on the Positive Pause are not intended to replace the services of trained professionals or to provide specific medical advice. To see the National Menopause Foundation's full medical disclaimer, please visit nationalmenopausefoundation.org.
Welcome to the Positive Pause. I'm Claire Gill, founder of the National Menopause Foundation. Joining me today is Jenna Perkins, a women's health and gender-related nurse practitioner at Healthy Health. Her practice is focused on helping women overcome their most intimate health needs. She prioritizes healthcare, education, and resources for her. Jenna's career as a nurse practitioner launched in a busy downtown DC office where she became an expert in urology, urogynecology, sexual health, and pelvic floor disorders. She is a member of several professional organizations, including the International Society for the Study of Women's Sexual Health, the International Society for the Study of Vulvovaginal Disease, and the North American Menopause Society, now known as the Menopause Society. She's also a member of the International Pelvic Pain Society and the American Urogynecology Society. Jenna designed this practice to deliver quality care in an environment that prioritizes patient education, evidence-based care, and time. We never get enough time with our healthcare professionals. When she's not helping her patients heal, you can find her enjoying being a wife and a mom of two little ones. Thanks so much for joining me today, Jenna.
Thanks for having me. I'm excited to be here.
I know we've talked so many times, and I kept saying I really, really want to get you on the podcast so we can talk about this very important topic and to let women know that there are healthcare practitioners like you who specialize in this area available. It's so, so, so important. So let's talk a little bit about that. What made you want to focus on women's health, and what made you want to get into the healthcare sector in the first place?
Yeah. So I like to say that I am raised by a healer. So my grandmother she was a reverend, but also was the person that people came to when they had illnesses that, maybe they didn't want to go to the doctor for. So she practiced folk medicine, essentially. So I was raised in that and lived my life with her day in and day out. So all I knew as a career was healing. I knew that I would go down that path since I was a little girl. And I found nursing, thought maybe medicine, but found nursing. And it just seemed like a great fit to be able to focus on education and really telling the client what's happening to them and empowering the client, but also being able to deliver care. And I'm a girl's girl. I am through and through a feminist. I love being a girl. I love supporting girls. And so women's health just kind of came natural to me, honestly.
Well, that's terrific. And it's really amazing that you knew that as a young child. It's funny, my mom was a nurse. I think I may have mentioned my mom was a nurse and she was a midwife. And the one career she told my sister and I not to go into was nursing. She was like, no, do it. But I think part of it is because things have changed so dramatically. And I'm fascinated now around, and I see this both in the Bone Health and Osteoporosis Foundation and the work that we're doing in menopause, the role of nurse practitioners and physician's assistants and how much of a influence and how much of a responsibility they now have in our healthcare system. So I think many people will say, like, I don't even see my doctor. I see the nurse practitioner in the practice and I see the physician assistant. And that's interesting given that we now have this level of healthcare professional who can prescribe what we need, but who have the time to talk to us in a way that it seems like our doctors don't. And so I'm curious, what made you then start your own practice focused specifically on this? How did you lead to that?
Yeah. So I practiced in academic medicine for a long time and spent some time in corporate medicine too. And it was a great place to be because I got to be alongside my colleagues who were fantastic and really learn from the best of the best in urology and urogynecology and general gynecology. So just having that cohesive care model within the academic setting was fantastic. And I was able to really learn so much. But it got to a point where I myself was just burnt out. And I accumulated so many tools and so many skills, right? Like typically, most providers, you kind of pick a niche and you stay there.
Yeah.
But I was lucky enough to land in the world of urogynecology, where you kind of have to be a bridge between bladder and vagina. So you have to have those skills. But then you also have to know how to do vulvar derm. You have to know how to do sexual medicine. You have to know how to do chronic pelvic pain, because it's all so interconnected. And so as I was able to develop more and more skills, I just felt like I was doing my clients a disservice because I didn't have the time to be able to say, hey, yes, I can help you with your recurrent UTIs and overactive bladder and painful bladder syndrome, but also that's affecting your brain, right? The same hormone loss that's changing your bladder and changing your vagina is also causing your brain fog.
Yeah.
And so it just got to a point where I was kind of wearing myself out trying to do a whole lot in a visit.
Yeah.
And academic medicine and corporate medicine is not really designed for holistic care. It's not designed for me to be able to sit down with you and dig deep and to address you head to toe. Right. It's designed to say you have an illness. Here is a prescription to address that specific ailment at this time. Come back later if you want to talk about something else. And so I just honestly got burnt out. I had my second baby after COVID, and I was just like, this is crazy. Like, what am I doing? I'm working so hard. I'm not making more money myself.
Right.
I'm not seeing the benefits of this hard work. And I'm also not being able to fully treat my clients in the way that I want. So I finally was just like, you know what? If I'm going to struggle, I'm just going to struggle on my own, you know?
Yeah.
And be able to practice in a way that I know that women deserve and give myself a fighting chance as a practitioner to practice in a way that I deserve to.
Well, I think that, again, that there's several things that you spoke to within your answer there that I want to get back to as well, because I think women don't know who to see for all of these different parts of the body. As you said, right? We are looked at as parts of the body versus our whole being, where, as you just said, the bladder and the vagina are connected. There's issues that go across both, right? We're not taught to think or respond in that way. So that's really important. But two, then that I've seen this rise a little bit, and there's been some articles about like nurse practitioners having their own businesses, right? And physician assistants having their own businesses and stuff. And so were you just at the forefront of this trend? Are you seeing more of your colleagues doing the same? Do you think that's the future, right? Where we'll go to a practice that'll be all nurse practitioners or all physician's assistants or some other type of healthcare professional?
I think MDs too, doctors too, I think are recognizing that the system that we work in is not designed for true wellness. I think that doctors have it harder in a sense because they spend so much time dedicated to working within these systems that it's harder, I think, for them to break away from it.
Yeah.
So I think that as a nurse practitioner, some of us come into it with a little bit less student loan debt, for instance, right? And so I think that gives us a little bit more flexibility to say, I can play a bit here.
Yeah.
Versus my MD colleagues, man, they got a lot of debt on them. And so why would they walk away from a system that will reimburse them well and have them have a fair chance at getting out of said debt? So I feel like they're kind of pigeonholed because of the training in a way that maybe they don't have the flexibility to start practices in the way that we're seeing with the nurse practitioner world. But I think that nurse practitioners also, we are responding to the fact that we are not going to be reimbursed at the same levels of our MD colleagues by insurances. We're just not, right? So you reach a certain pay cap. I wasn't not making enough money at my academic medicine job because I wasn't doing a good job or because my boss didn't want to pay me more. It was just the way that it was designed. You're a nurse practitioner. You get reimbursed this rate. That's the way that it is. That's all we can do. So I think that nurse practitioners, but also doctors, physical therapists, mental health providers, I think we're all recognizing that the writing's on the wall and that if we want to practice in a way that is healthy for our patients and healthy for ourselves, if we don't want to give ourselves up, sacrifice ourselves to practice medicine and be in healthcare, then we got to do something different.
Something's got to change. Something's got to change system-wise, like you said, because the system is so broken in general. And we know we could spend way too much time talking about that, but there's so many reasons. And I think sometimes people, when we're looking at it as a patient, we just see, oh, the insurance costs us this, and, the doctors are paid this. And I was sharing with my husband, I had carpal tunnel surgery, and I went back in to see the surgeon today. Fabulous surgeon. The surgery went well, but I drove 45 minutes to the practice. I paid tolls for the express lanes. I sat for 40 minutes past my due time for my appointment. And I was with the surgeon for, no lie, less than 2 minutes. Mm-hmm. And that was done. And that's it. Right. And I'm like, I can't believe how much I paid for less than 2 minutes of his time. Right. Mm-hmm. And so all of that, right, are reasons that we need to do a better job across the board in figuring out how do we make medicine work for, like you said, both the healthcare professionals. They're not doing this just out of the goodness of their hearts. But like I said, so many are, because they're not getting paid. They're not getting reimbursed. They want to have more than the 15 minutes with us that they can now get reimbursed for, right? But all of that. And then also, like you said, let's get back to that, like the holistic person thing. So when I was reading your bio, I was looking through, I mentioned in the introduction, all the different societies that you belong to, right? We were talking about urology, urogynecology, pelvic floor, and then obviously the menopause specific ones and the general gynecology. Mm-hmm. So can you talk a little bit about how the whole pelvic floor region, what it is? First of all, we've done this before in podcasts. I think it's so worth describing to women. What is the pelvic floor region, and how is it all interconnected when it comes to symptoms we might be having at menopause or at other times?
Yeah. I like to say that the pelvic floor is the seat of life. And that is beyond just the fact that your pelvic floor is obviously where you carry life, where you give life with birthing, but also how you live, right? It is literally how you breathe. The diaphragm is a little muscle that allows you to be able to inhale deeply, is located in the pelvis. Having bowel movements, that is pelvic floor work. Being able to pee and urinate, right? That's pelvic floor work. Being able to be intimate, that's pelvic floor work. Being able to simply sit down or drive comfortably. Being able to be in motion, to walk, to run, to bend over, that's all pelvic floor work. Your hip is your pelvic floor.
Yeah.
So it is central to what it means to be human. All of your most essential functions come from or are connected to the pelvic floor. And we are one big zipper, right? So what's happening in the pelvis is going to be reflective of what's happening in the jaw and what's happening in the neck, right? But the pelvic floor, again, is where you pee, where you poop, where you are intimate, where you breathe, where you sit. It is the most essential functions are happening in the pelvic floor. And it's a group of muscles that work like a hammock to hold your bladder up in place, to hold your rectum down, and to hold your uterus up where it needs to go. And also your bowels and everything else that is located in the abdominal cavity and in your pelvis. And so where you have so much function, there's room for dysfunction.
Exactly. Yeah. Yeah.
So at every turn, if it's in charge of peeing, pooping, breathing, right? If you have a problem with your poop, then you might also have a problem with your breathing and your peeing. Right. And it's all connected in that way. So yeah, it is the seat of life.
It is the seat of life, truly, right? And again, it's not, other than the functionality of our reproductive organs, that's which we get in puberty class when we are 5th and 6th grade. That's the end of education for women and men about how their bodies function in most cases. And when there is so much connected to how we live, like we said, and what happens to us in that part of our body, it's really doesn't make sense that we don't know more about it and that we don't have more healthcare providers like you who are available to support us to care for that whole region of the body. And as you said, though, even though we're talking about the pelvic area and the seat of life, as you said, it's connected to your brain and it's connected to the rest of your body. You're going to feel it everywhere in your body when there's something off in our pelvic area.
Yep. And your pelvic area will feel it if there's something off other places, right?
That's right.
Meaning if you're having more irritability and anxiety, you can have more pelvic floor symptoms.
Yeah.
Because imagine if a bear starts chasing you, you go into that fight or flight. What's happening physically is affecting your pelvic floor.
Yeah.
So you might pee your pants because you're so afraid, right? Or your muscles might tense up because you are so afraid.
Yes.
Something is going to happen where it might be something that's happening in the brain, anxiety, but it's also going to be affecting you in the pelvis.
Okay. So if we're talking about, let's start with health. When we're talking about keeping ourselves healthy, are there things that we should be doing on a regular basis or work out on, and things we need to be thinking of to make sure that we have a healthy pelvic floor area?
Yeah, I would say breathing is number one. You have to start there. So acknowledging that you might be more tense than maybe you recognize. So are you having trouble starting your urine stream? Are you having constipation, even if it's just intermittent? Do you feel that tension when you're about to have intimacy with your partner? Do you feel like, oh my God, I'm so tight, I can't relax and release? And breathing can be super helpful to whenever you're feeling any of those things. Take a deep belly breath, allow your belly to expand as you inhale and release, and really allow your pelvic floor muscles to relax as you exhale. And in all of those situations, it can really help to address some of the discomfort. So just starting to give permission for yourself to tune into your muscles and feel and really acknowledge, am I tight? And once you have that acknowledgement, give yourself permission to simply just breathe and release the tension that you might be experiencing.
It's so funny because, again, none of us really think about breathing, right? Since it's a natural thing that we do. But in so many areas of our lives now, we're learning how deep breathing, right? That intentional breathing, I guess, maybe, is so critical to so many things that we do, whether anxiety or mental health in general, right? And now you're talking about like, wow, even for this, learning to do those deep breathing exercises can really benefit us over the long term. It doesn't.
It's essential.
Yeah. It seems like, well, oh, I don't need to do that. Or, oh, it's why would I need to deep breathe? But hey, this is really a good practice then to get into and to learn early and do often, right?
100%. Toddlers should do yoga and learn how to do breathing. It's great for emotional control and just, again, giving yourself permission to be aware in your body. Yeah. When you have pain, when you have dysfunction, we oftentimes disassociate from our bodies. And one of the first things we need to learn how to do is to be able to breathe so that we can come back into our bodies and actually experience so that we can start to facilitate healing and wellness.
It's so funny. I never made the connection to like the deep breathing and like the hesitation or the tenseness, but I would laugh all the time with my healthcare providers, particularly when I was pregnant, that I cannot pee on command. If you present that cup we're all very familiar with, my body shuts down and it doesn't matter. I could drink gallons of liquid before my pregnancy appointments when they were going to make me do that pee in a cup test, and I would not be able to. And no one ever, by the way, said, take some deep breaths, just like relax. Like I know my body's tensing up for it, but I didn't know what to do to make it happen. Right?
Yep.
Turns out.
Next time you have it, I want you to imagine that you have a straw or get an actual straw. And then I want you to take deep breaths in through the nose, belly gets big, and then exhale through that straw.
Interesting.
And that is a really great way to start this breathwork process.
That's such a great tip. That's such a great idea. Yeah, for anybody, right? So what does deep breathing really feel like and mean, you know? And I love that straw thing because then we were also talking with one of our medical advisory committee members is also a pelvic floor specialist. She's a physical therapist though. And she on the podcast was describing what it should actually feel like if you're doing a Kegel exercise, right? And I thought that was so great because again, we're told to do them all the time, but no one tells you how to properly do it or what you should be feeling. And it turns out like what most people feel when they do the Kegel is they're doing it wrong.
Right. Right. And I don't even encourage people to Kegel because I know you're doing it wrong, right?
Yes.
I know that you're focusing on the tension and you don't have the tools yet to be able to relax. So I don't even encourage people to do Kegels until you can breathe.
That's so important, right? To be able to, like you said, it's like going to the gym and using a machine and you're using it wrong, right? The muscle, you're going to do more harm to the muscle if you're not doing it right. And so similarly, right, doing things that we think are good for us, but if you're not doing it right, if you don't have the proper technique, you're not getting the full benefit from it. So we're going to start deep breathing. That's going to be one of the main things we're all going to do to be able to have a healthier body, healthier mind, all of that, but getting us into that, making sure that our pelvic core is good. What other things do we need to do, Jenna, to make sure that our pelvic floor and our pelvic core is healthy?
Yeah. So definitely drinking plenty of water. You want to make sure that you're drinking water. I do find that a lot of people who might have these overactive bladder symptoms or leakage, they limit water because they're like, I don't want to pee all the time. But you make urine no matter what, your body is going to have to excrete waste. And so if that urine is more concentrated because you are dehydrated, you actually can have more bladder irritation. So you're not doing yourself any favor by limiting your water, trying to not go to the bathroom more often, because sometimes it can be more irritating to actually not have enough volume in the bladder because it's more concentrated, more irritating to the bladder. It also makes you more prone to urinary tract infections. So definitely deep breathe, drink your water, don't Kegel.
Don't Kegel until you learn to do the deep breathing. Right.
You learn to do the relaxation. And then giving yourself grace, I would say, honestly. I have so many people that come in and they are like, I've been doing this. I sat on the little chair and I've been doing my Kegels and it's only getting worse. And what's really happening is you are digging yourself deeper into a hole and causing yourself more stress, right?
Yeah.
And more tension when really you just need to allow healing to happen. You have to allow space for healing to occur and don't give yourself grace and know that you're not feeling well because you're not doing the work. It's not that you're not doing enough.
Yeah.
Maybe you just need to pivot and do things differently. So I don't want people to take away that they need to go out into the world and start lifting heavy weights or start doing all of these other things. First, you need to start simple, which is acknowledging how your body feels and really stop disassociating from your body.
Yeah.
That one.
That's really, really important. So then let's talk about, for women listening and probably men too, when do we get to the point where something that's happening to us might be a problem? Now, I'm sorry, I guess it's whenever it's like disrupting your life. But so if we say almost all women experience some type of incontinence around menopause, right? Where we're not able to hold it the way we used to, right? I think about like the bladder buster parties in college where like the first person to drink, the drink started to cost. And so you were really holding on. All of those kinds of things. Those days are long over. So body changes, right? We change slightly as we go through this process, this natural process of menopause. When should women be concerned, I guess, about what's happening in their pelvic floor area? And when would they seek out an expert like you? I mean, it doesn't necessarily need to be just when we're having issues, but if that happens, what are some of those signs?
Yeah. So if you are having vaginal dryness, even if just slightly, if sex becomes uncomfortable, if you're having vaginal or bladder infections, if you are distressed by anything, if you're having itching, if it's anything that is interrupting your activities of daily living, that might be, I can't work because I have to pee twice during an hour-long meeting, or, I'm not sleeping well because I have to wake up to pee 2-3 times in the night. It might be, I don't want to socialize because I'm scared I'm going to be incontinent. And so I don't want to go to these social events. Whatever level of distress you feel is enough that you want solutions are available to you. And to your point, you don't have to wait until you are having any distress. If you want to be preemptive, if you're like, you know what, I know that I am perimenopausal and I know for a fact that my bladder is going to change, because if you don't do anything about it, it will change. Your Vulval vaginal tissue will start to get smaller as you age. You'll lose your labia. The tissue will become thinner. You will be more prone to UTIs. Your bladder will be more sensitive to irritants with time. And so if you're like, I don't want to deal with all that foolishness, then what you can do is you can start vaginal estrogen when you talk to your healthcare provider, and so that you can say, I don't want to become incontinent. I don't want to become dry. I don't want to become irritant. I know I'm in this phase of life. It's coming. I want to start it today. That's completely appropriate.
Yes. Let's talk about the amazing, the wonderful estrogen and how important it really is to women's overall health. So yeah, you talked about that when we're in perimenopause, and that's so for those again listening who may not know, perimenopause can go on for many, many years, generally 5 to 7 years before you reach your last period and go into full menopause, right? And for other women, it lasts even longer.
Decade for Black women.
Yeah. And exactly. Be very much aware as you're journeying through this life that this area is one thing where in particular our ethnicity does impact how we experience symptoms of perimenopause and menopause. So when a perimenopausal woman starts to feel some of these different things happening, and like you said, she's still having her period, like me, she could still get pregnant in her 40s, but still starting that journey, they can come in and speak to you about what are the options available to be able to treat some of these symptoms when they're happening. So can you talk a little bit about the types of estrogen, the topical estrogen versus oral, et cetera?
Yeah, for sure. So first we'll start with local versus systemic. So local estrogen is typically a cream or a vaginal insert, and it's only going to work where you put it. Meaning you put a little bit of cream on the urethra or in the vagina. That is great at helping local areas there with the bladder and the vagina. It will not help you systemic wise. So it's not going to affect hot flashes, brain fog, joint pain, just wherever you put it. A different form of local estrogen would be maybe if you get compounded estriol, which is a pretty weak form of estrogen inside of a moisturizer, and you apply it to your face or your hands for anti-aging properties.
Okay.
So those are localized therapies. They will not affect you systemically. The thought is that you're not going to have any changes in your blood levels from using those therapies. Those therapies are thought to be really safe for almost every woman, no matter age. And really, even if you have a complicated medical history, most women are able to use these therapies. Systemic estrogen is going to be, in its name, like its name implies, system-wide. So these are going to be therapies that you can use topically through the skin. I prefer to use it through the skin because then we're not running into a situation where we have any increased risk of blood clots. Just like when you take the birth control pill, there is an inherent risk of blood clot with doing estrogen by mouth because it is processed by the liver, and so it increases clotting factors. That risk factor is very small with hormone replacement therapy. Even if you were to take the oral estrogen for menopause care, it's smaller than if you were to take the birth control, smaller than if you were to have a pregnancy. But it does exist. And so to avoid that, for most women, I like to do a through the skin approach. And so most women are going to be able to be candidates for a transdermal estrogen. And so this can help with, we actually have really good data of preventing bone changes that like osteopenia and osteoporosis. So when we talk about longevity care and living longer, we actually have really good data that says that we can prevent disease in the bones with estrogen. So that is awesome, awesome, awesome. And so if you are a woman who wants to live longer and healthier in her later years, maybe you come in and you're like, hey, I want to come and start on estrogen because I don't want my bone changes to start. And so even though I'm not symptomatic, I want to start now. I'm 40, whatever years old. So we have the oral estrogen, which is still a good option for people who maybe they can't tolerate the through the skin. It's easy for them to just take a daily pill. We just need to make sure that they are aware that that small increased risk of clotting exists with them. So that's the estrogen types. The local estrogen creams, again, good wherever you place them. And then the systemic estrogen, I prefer to do it through the skin approach, but oral estrogen is also available.
Yeah.
All of this is very well covered by insurance.
It's terrific. And like I said, I don't think we're not aware of what's available in hormone therapy these days because 20 plus years ago, that were doing scientific studies. And when they were looking at it, they said that there was an increased risk for some conditions, heart disease and breast cancer with estrogen. But we now know that that was looking at women who were starting on estrogen more at the age of 65 versus women who were starting perimenopause or menopause, and there was no risk for women at that level. So that has changed dramatically. And I think if you come from a generation where you heard that there were these issues, even I think for me, Gen X, we might be the last one generation that actually remembered when that happened and what a big news thing it was and stuff like that. And then certainly it's impacted us as we reached menopause. But now, hopefully, when you see a clinician and you talk about it, they are more informed about what that really means. And we have a lot of work to go to still inform and educate clinicians. But for women listening, it is, as Jenna said, it has been proven to be safe and effective. And so that type of risk, thank goodness, is no longer something that we need to worry about. And the fact that there's all these options, right? And so now there's a new class of like non-hormonal also types of estrogen or hormone therapy, I should say, that are coming out. And those just help with the hot flashes and night sweat stuff, right?
Yeah. So there are specific medications that can help every symptom, right? So when we're talking about perimenopause, there are medications that are out there that will just help the hot flashes, right? So we're thinking the newer medications that are on the market, but they won't help with the root cause, right? So they're not addressing the hormone loss that's making you have the hot flashes. You have the antidepressants that might help your mood. You have the hair medications that might help your hair loss, the skin treatments that might help your skin. But truly, I like to start with like, let's address the root cause, because if you don't want to be on all of these different medications, why don't we just address that with the hormone therapy and then add other medications as needed down the line?
Yeah, it's true hormone. And it is that we said like you're talking about the pelvic area is like the pelvic floor is like the, the seat of humanity kind of stuff. Well, then that's really the same thing with estrogen, that it is such an important role throughout our bodies, not just in our reproductive organs, but hair, mind, skin, eyes, teeth, brain, all of it is impacted by estrogen. And I don't know if other women were more aware of this, but really, even after doing this for the Menopause Foundation for many, many years, it was more recently that I learned that what's in birth control is actually more estrogen than what we're given when we talk about hormone therapy at menopause. And I was like, wow, I didn't think anything about taking birth control, right?
And your provider didn't think anything about prescribing it. And it's
And then
synthetic hormones too.
Yeah,
so meaning it doesn't.
And so we're learning, right, ladies? We're learning that there's things that we need to be aware of and be able to do. And then obviously we have to go to healthcare professionals like Jenna, who can help us figure these things out and who are staying on top of all the advancements and everything that there is to know in a science-based practice to ensure we're getting really, really good care. I'm so grateful, Jenna, that you are focused on women's health and that you are giving women the time and the education they need to be able to live healthier lives, because knowledge really is power. When we know this, even like we said now, all of us listening about start with deep breathing, use a straw to practice. Those are great things that every person can do that will actually make us a little bit healthier.
Yep. So definitely take that into your practice. If you are having any sort of constipation, any sort of trouble with orgasms, any sort of pelvic pain, start with that very simple thing. And then meet with the healthcare professional to figure out what else you need. And don't feel like you need to be doing all of these things, taking all of these medications, all of these supplements. It's not that you are not working hard enough to feel well. It is that you are in a phase of life where your body is changing and you need support to help you through that change.
That is great advice. I thank you so much for sharing that with us and for being there to support women. We are going to put information about Jenna and her practice and some of the tools and resources related to this topic with the notes for this podcast. And again, Jenna, I appreciate so much your sharing your time and your expertise with us. I am so delighted that you're local to my area so that we can all take advantage of your expertise, but also we'll put in information about how you can find experts in your area who can also help you navigate this time of life. I hope you enjoyed this episode as much as I have. If so, please do the two things I always ask. Please make sure you subscribe to the Positive Pause podcast so you don't miss an episode. And please share the information with your family and friends. We need to get as many women and families who are living with someone going through menopause to understand and be able to get access to this great information. Thanks again to my guest, Jenna Perkins, women's health practitioner at Discover Health. And thank you for listening. We hope you'll tune in to another episode of The Positive Pause.